Here I am at home on home quarantine doing some light reading. This is the thing. I was exposed to coronavirus because my idiot son Luke decides to do an intern year at a Wuhan meat market. I mean, who does that? There's a Ruby Tuesdays down the street, Luke. You should have gone there. Yeah, they don't serve fresh civet cat, but it's considerably safer, all right? And now here I am stuck at home on a 14-day quarantine with no pay because I make RVUs and I can't see patients. So here I am, ready to go, nowhere to go. I don't even understand why coronavirus is such a big deal. What is it so far to date? It's killed 28 Americans. That's like half a mass shooting on a good day, or like any 2-hour period in Chicago. And first of all, how can the administration think that I've been exposed to coronavirus? I wear a mask, bro, 24/7, and gloves. And you know what occupational medicine said? Oh, but it's not N95 certified, so it doesn't count. I'm like, it's been hermetically sealed by the emperor himself. Like nothing can. Patients are trying to steal this mask from me because they're panicked. And I'm like, bro, I need that mask to live, okay? It doesn't do what you think it does, all right? It keeps Vader alive. And the nurses, they don't even care. You think they have masks? Some patient's family member already stole all of them. And they're like, I got a kid to support. I can't be out of commission. They go in full commando. No mask, no nothing, into the patient's room. They take care of patients. That's what they do, right? They're brave. They're fearless. Half of them are now quarantined, all right? And then, of course, they find out that bed 4 is positive for bed bugs, and at that point, it's like, call the union. We're going on strike. Get the hazmat suit out. It's a very different scenario. Nurses know when to panic, bed bugs. And the whole time, the administration, you're like, okay, here it is, a big crisis. The whole purpose of administration, of having an MBA, is to understand the ins and outs of managing the medical system, supply chain management, coordinating with the government and the CDC, making sure our frontline providers are resourced, using that EHR that you developed to follow data and make sure we can understand emerging patterns of infection, resourcing through our not-for-profit hospital all those profits we made into keeping ourselves safe from the next pandemic. And so the first patient hits the U.S. with coronavirus. I got an email already from administration. It just says urgent coronavirus. Read now. And it says, the administration is very aware of the evolving situation on the ground. You may have heard of coronavirus. We're all very concerned. We want to make sure everyone is safe. The supply chain is managed. The CEO's bonus is assured. I mean, it was $3 million. We're going to put it all into keeping our frontline healthcare providers on the front lines, taking care of our most vulnerable patients. And to do our part, as of yesterday, upper management will be working from home. Two days later, I see the CEO of the hospital in Costco. He's wearing an N95 mask that he stole from a nurse. He's buying an industrial tub of hand sanitizer, and he's wrapped up in hoarded toilet paper like the goddamn Michelin Man. The whole time, eating those little sausage samples. I'm like, bro, that's not how this works. That's not how any of this works.